Yesterday, I watched a video for Dr. Gavin Chan talking about the reasons why he stopped injecting fillers in the tear trough area. And I think that this video was made in a way that confused a lot of people, and that's why I decided to talk about some points that were discussed in this video in order to clarify them. But before we start, let me first introduce myself to those who don't know me. My name is Dr. Mohammed Nazer. I'm a dermatologist. I live in Egypt, and I'm an official trainer, and I'm considered one of the most conservative doctors. I always tend to inject the minimum amount of filler needed in order to correct the things that we want to correct in the face, and I tend to preserve the natural look and the features of the person himself. I really don't like to make big changes or fill the face in a very exaggerated way, because I believe that everyone has his own beauty. And I'm telling you this in order to know my background and to know from where I'm coming from regarding discussing these points. In the last few years, Dr. Chan made few videos about fillers, discussing the longevity of the fillers, and he succeeded by using the MRI imaging to prove that fillers last for many years after injection, not like what other people say that fillers last for 6 to 18 months. And to be honest, he's not the first one who said this information. About 10 or 12 years ago, some studies were made and found that the fillers can last up to 3 or more years. And also in 2014, I saw Dr. Frederick Byrne talking about the fillers. He used ultrasound to detect the amount of filler remaining after 2 years of injection, and he found about 80 to 85% of the fillers in the tear trough area found after 2 years by using ultrasound. But not so many people knew this information, and I used to tell people that fillers last for a longer period than they expect, and that fillers can really last for more than 10 years in some cases, especially in the tear trough area, as I saw from my work. But actually people did not believe me until Dr. Chan made his video and proved to everyone that fillers can last for many years. And now I can very easily tell the patients, go watch this video, and they return back to me saying, yes, now we believe that the fillers can last for more than 1, 2 or 3 years. But then he made 2 videos that I disagree with. The first one was about 1 or 2 years ago, saying that he can fill the whole face and correct the whole face using only 1 ml of filler, and the other one that was posted about 5 to 6 days ago, explaining the possible complications of injecting dermal fillers in the tear trough area, and saying that he will not inject the fillers in the tear trough area anymore. And although I agree with most of the points he mentioned in his video, but I think that the videos were made in a way that is misleading to a lot of people. So let's start by the last video about the tear trough. He said that he will not inject the tear trough anymore because the fillers are hydrophilic. This means that it absorbs a lot of water and it can cause swelling. The second point is that injecting the tear trough area is not suitable for everyone due to the presence of the tear trough ligament. Third point is that it could be placed in a place that is hard to dissolve. So if you wanted to dissolve it using the hyaluronidase enzyme, we will not be able to do it easily. And he found 2 cases. One was injected with a cannula and one was injected with a needle that he couldn't dissolve. And then he sent it to another doctor who used an ultrasound to detect the place of the filler and found that the filler was found near the globe. And he used the ultrasound in order to be able to reach the filler and dissolve. So actually, if we take a look at these possible complications that he talked about, we will find that these complications could happen in any other areas in the face. Swelling can happen, migration can happen, and also injecting any area in the face is not suitable for everyone. But in fact, if we compare the injection of the tear trough area to other areas like the lips, or the nose, the nasolabial folds, or the temples, we will find that the possibility of serious complications in these areas are much more than the injection of the tear trough area. But the message that was delivered to a large number of people after the video, that it's okay that you inject these areas, but the tear trough area, it's not okay. And to be honest, any complications that could happen from the injection of the fillers in the tear trough area or in any other areas are mainly due to the technique by the doctor, the amount of filler used, the type of filler used, and choosing whether this injection is suitable for this person or not. So if you will decide to avoid injection of the fillers in order to avoid the complications, then we will not inject any fillers in any areas in the face, which in my opinion is not the right choice, because any medical procedure carries some possible complications, and we should avoid these complications by going to a trained person, using good materials. Do not go for 100% correction, and discussing with the doctor before doing anything if this thing is suitable for me or not. So what I do with my patients in my clinic is that I always tell them that a tear trough injection is a one-time injection. You will do it only once and forget about it. You will not need to repeat it after 1, 2, or 3 years. The second thing is that I used to correct the tear trough area 100%, but now I only go for about 70 to 80% correction, as I know that by time this filler is hydrophilic and it will cause some swelling, and this swelling will fill the rest of the 20 to 30% that I left in the coming 1, 2, or 3 years. And definitely I don't inject the tear trough to anyone, just the very few people who really needs it. And lastly, I use very specific types of fillers that suits this area the most. The second video he made about 1 or 2 years ago, saying that he can correct the whole face using only 1 ml of filler. Well, this can happen if I'm just doing very, very few things. In some patients, we use only 1 ml, but this cannot correct any deformity. So for example, if you want to correct the chin alone can take 1, 2, or sometimes 3 mLs. If you have someone who has a significant volume loss in the cheeks, or the temples, or the nose, or the lips, if you will do all this with only 1 ml of filler, you will not notice any difference. So in this case, for example, we used about 8 ml. In this case, we use about 9 ml. And in this case, we use about 9 ml. And in my opinion, they all look natural. But the thing is that these patients will not repeat this filler again. They will only do it in the first time, and maybe after a few years, they can add 1 or 2 ml every few years in order to maintain these results. Because as I mentioned earlier, that I do agree with him that fillers last for many years. So the conclusion to anyone who is considering injecting fillers in the tear trough or in any other area in the face, in order to get the best possible results and avoid any complications, number 1, choose the right doctor. Don't try to fully correct anything. Try not to overdo anything. Those people who follow the trends of very large lips or very big cheeks or very wide mandible or these things, I don't really prefer these things, because on the long term, I don't think you will look so beautiful. And discuss carefully with the doctor before injection what are you aiming for, and the technique that will be used, and the type of filler that will be used. And lastly, yes, the fillers last for so many years, so don't repeat it so often. See you next time.